the professional practitioner. So by the end of this video cast, you should hopefully be able to complete task 4. You should be able to identify areas where ethical dilemmas may arise and be able to explain how these dilemmas may impact on health and social care workers. So firstly, we're going to start off by looking at potential conflicts. So when working in health and social care with vulnerable groups of people, there will be times when care workers are faced with conflicts of interest. Often, these ethical dilemmas will not have a correct answer and will depend upon a number of considerations. Nevertheless, as the care worker, you're still faced with a dilemma and are still expected to make a decision based on your best judgment. So it's important that care workers consider these 4 points. So what are the risks to the individual? What are the professional and legal responsibilities? What are the policies of the organisation? And have I got all the facts of the case? In doing this, the professional care practitioner will often be able to draw a balanced view and conclusion to the ethical dilemma that they are faced with. Now, there are often different areas for the practitioner where dilemmas may arise. These are within the rights and responsibilities and duties of the practitioner, balancing service need with resources, looking at conflicts of interest, considering choices of support, and considering harm minimisation. Now, in considering the first of these points, rights, responsibilities and duties, legislation, policies and codes of practice provide clear guidelines as to the rights and responsibilities of care workers, and these should be adhered to at all times. So the professional practitioner should remember that they work within a legislative framework and there are a number of policies and codes of practice that they must follow. The duties of a care worker are clearly laid out in such documents as well as in the contract of their employment. So when you are on placement, you should have a look at the different policies that the organisation has in terms of how you need to behave. As a care worker, when you're dealing with the rights of vulnerable groups, you may find that the rights of 2 individuals may clash. An example of this would be that if you were working in a supported housing project, one resident may enjoy playing their music loud late into the night, and another resident may prefer to retire early in the evening and get up early. Therefore, you would have a clash between the rights of the 2 individuals, and it would be for you, using those 4 questions identified, to try and draw out a correct solution to the situation. Another example of where rights, responsibilities and duties may clash is when considering cultural or religious values. For example, a Jehovah's Witness who do not agree with blood transfusions may find themselves in hospital and the only means of saving their life is through a blood transfusion. Therefore, there's a clash between the individual's rights and the responsibilities and the duties of the professional care workers. Now, when we're considering balancing services and resources, you have all seen that there's been a lot of discussion about the way in which health and social care services should be provided, especially when there's limited funding and almost an unlimited demand on the service. So as a social care worker, you'd need to make practical decisions on how resources should be allocated, and these decisions are quite often difficult to make. So should children and young people be prioritised as they have their whole lives ahead of them, or should consideration be given to the ageing population who have paid both the national insurance and the tax for longer periods? Should the focus be on people living in poverty, or should a focus be placed on people who have disabilities? An example of this balancing service and resource would be a critically ill child who needs a very expensive surgical treatment and has low survival expectancy. Should the NHS do the operation, or should that money be put to one side to treat hundreds of tonsillectomy operations? Which would you consider more important? Now, you may find that when working with vulnerable people who are receiving social care services, that you will experience conflicts of interest. So for example, an older person who is a wheelchair user and is living in a residential home may be a smoker and may be unable to give up the habit of smoking. Yet, the legal requirements and the policies and procedures of the organisation state that the environment does not permit smoking. How would you deal with that particular conflict of interest? Should the older person have to go outside the building to smoke, or should there be a designated indoor smoking area? Now, as a professional practitioner, when choosing support choices, it's really important that individual clients are listened to and that their choices are acknowledged. So, considering people that may live in supported tenancy environments such as a care home, this could mean a choice of a menu rather than just allocating particular meals. It could mean a choice of activities and hobbies and interests, and these would need to be discussed with the person's key worker rather than just having a timetable of activities dictated to you. Finally, we come to harm minimisation. Now, one of the most important aspects of providing effective health and social care services is ensuring that the general environment is safe for individuals who are receiving a particular service. So if you consider an early years service, it's really important that a risk assessment is completed on the environment and on any set activities before the children enter that environment and participate in any activities. So hopefully this video cast has given you a flavour of some of the ethical dilemmas that a practitioner has to consider on a daily basis completing their activities.